Mandible is an unpaired facial bone. It is the largest among the facial bone. Parts of mandible, it has a horseshoe-shaped body. It has two rami, the right ramus and the left ramus. Body has two surfaces, external surface and internal surface, and two borders, superior border and inferior border. Features of the external surface are it presents a median ridge called as symphysis menti formed by the union of two halves of the mandible. Below the symphysis menti, there is a protuberance called as mental protuberance. Mental in Latin means the chin. There are two tubercles called as mental tubercles present at the inferolateral angles of the mental protuberance. External surface presents a line called as external oblique line. External surface presents incisive fossa below the incisor teeth. External oblique line gives origin to buccinator muscle, depressor labii inferioris and depressor anguli oris. The incisive fossa gives origin to mentalis and the orbicularis oris. External surface presents a foramina called as mental foramina. The mental foramina transmits the mental nerve, mental artery and mental vein. Internal surface presents a prominent line called as mylohyoid line. Below the mylohyoid line, there is a groove called as mylohyoid groove. Mylohyoid line gives origin to mylohyoid muscle. Posterior aspect of the mylohyoid line gives attachment to the pterygomandibular raphe and the superior constrictor of pharynx. The fossa located below the mylohyoid line is called as submandibular fossa. The fossa located above the mylohyoid line is called as sublingual fossa. Submandibular fossa lodges the submandibular salivary gland, and the sublingual fossa lodges the sublingual salivary gland. Internal surface presents two pairs of genial tubercles, the upper and lower. The upper pair of the genial tubercles gives origin to genioglossus muscle. The lower pair of the genial tubercles gives origin to geniohyoid muscle. Body has two borders. Superior border is also called as alveolar border. It will be having the sockets for teeth. Alveolar sockets of the superior border use attachment to the roots of teeth, forming a gomphosis type of joint. There are 4 incisors, 2 canines, 4 premolars, and 6 molar teeth. Inferior border is also called as the base. It presents 2 fossa near the anterior end called as digastric fossa. Digastric fossa gives origin to anterior belly of digastric muscle. Base gives insertion to platysma muscle. Ramus is quadrilateral in shape. It has two surfaces, external surface or the lateral surface and the internal surface or the medial surface. And it has 4 borders, superior border, inferior border, anterior border and posterior border. And it has 2 processes called as the coronoid process and the condyloid process. Posterior part of the external surface is related with the parotid gland, and the external surface gives insertion to the masseter muscle. Internal surface presents a foramina called as mandibular foramina which leads to the mandibular canal. There is a tongue-like projection called as lingula, and below the mandibular canal there is a groove called as mylohyoid groove. Mandibular foramina transmits the inferior alveolar nerve and the inferior alveolar artery. Lingula gives attachment to sphenomandibular ligament. Mylohyoid groove transmits the mylohyoid nerve, a branch of mandibular division of trigeminal nerve. Internal surface gives insertion to medial pterygoid muscle. Superior border is notched, called as mandibular notch. Mandibular notch transmits the mesenteric nerve, a branch of mandibular division of trigeminal nerve. Anterior border is continuous with the external oblique line. Anterior border of the ramus gives insertion to temporalis muscle. Posterior border is thick and it makes an angle with the inferior border called as angle of mandible. Angle of mandible gives attachment to stylomandibular ligament. Coronoid means that which resembles like a crow's beak. It is triangular in shape. Coronoid process gives insertion to temporalis muscle. Condyloid means knuckle-like in form. Condyloid process has a head and a constricted neck. The neck has a pit anteriorly called as pterygoid fovea. The head articulates with the mandibular fossa of the temporal bone, forming the temporomandibular joint. The pterygoid fovea gives insertion to lateral pterygoid muscle. Age determination of mandible can be done by the position of the mental foramina. The mental foramina is present nearer to the lower border at birth because the subalveolar bone is not formed. At the adulthood, it will be in the middle because the subalveolar bone is formed. And during the old age, it will be nearer to the alveolar border as the bony resorption of the alveolar border occurs. Sex determination of the mandible can be done by the shape of the body. Male mandible body is square shaped, whereas female mandible have a pointed chin. Sex determination can also be done by the angle of mandible. The angle of mandible is everted in males, whereas inverted in case of females. Common site of fracture of the mandible are the neck of the mandible associated with the displacement of temporomandibular joint, the angle of the mandible involving the bony socket of the third molar teeth, the body of the mandible through the socket of the canine teeth. Among these, the fracture of the body of the mandible through the socket of the canine teeth is common. The clinical findings are mandibular pain, malocclusion of the teeth, separation of the teeth with intraorbital bleeding, inability to open the mouth, preauricular pain, and hemorrhage or ecchymosis in the sublingual area. This figure represents the common sites of fractures of the mandible. A highest rate is the body 30.8%. This X-ray represents the fracture of the body near the canine teeth. Resorption of the alveolar bone occurs due to the extraction of the permanent teeth, which causes the alveolar bone to get resolved. The sockets of the teeth gets filled up with bone and the vertical dimension of the skull becomes reduced. Mandibular prognathisium occurs, which leads to overclosure. Deep creases of facial skin appear that passes posteriorly from the corners of the mouth.